Good to Go segment is made possible by Spectrum Health Medical Group.
You've probably heard about osteoporosis, but do you know what causes it and what might put you at risk for developing the condition? Dr. Arashdeep Litt is a board-certified internal medicine physician with Spectrum Health Medical Group, and she's here to discuss what osteoporosis is and the importance of maintaining good bone health. Good morning.
Morning.
Okay, so first, what is osteoporosis? I know it has to do with your bones,
Yes.
but what exactly is it?
So it's essentially a disease of the bones where there's not as much new bone forming,
Okay.
or there is too much bone being lost. So essentially there is less quantity of the bone, and whatever is formed is poor quality. So essentially it increases your risk of having like fractures with minimal trauma, so fragility fractures can happen. So essentially it's a disease of the bone with poor quality and less amount of bone, if you will.
Okay, now one thing that people might not know, your bones are growing all the time.
Yes.
So it's not like this is something that happens when you're real little and it's just whatever.
Yeah.
Your bones are growing all the time.
Yes.
Okay, that's something that it took me a while to understand what the
Yeah.
tissue is
Yeah.
growing. And
So there is formation and then there is loss happening
Okay.
as well. When you're younger, there is more formation and
Okay.
less loss, whereas when you grow older, there is less formation and more loss, and that's why osteoporosis is mainly a disease of a little bit more than 65 and older.
Okay,
Yeah.
okay. Now, is this a common thing?
It is actually 54 million Americans at any given time would have it, and then 1 in 2 women. So essentially we are 2 here, and one of us is going to fracture a bone once we hit 50.
Oh,
and
no.
Yeah, and then even in men, there's not as much emphasis paid to males and osteoporosis. So 1 in 4 men will actually fracture a bone due to osteoporosis once they hit 50.
Okay.
Yeah.
Now, obviously it has to do with bone loss and not growing that new bone as quickly, but what are some of the causes of osteoporosis?
So age is one, the older you get, the higher your chances. If you have a family history, if your
Okay.
sister or brother or your mother had osteoporosis, higher chance of you. Genetics plays a role. There are certain medical conditions, there are certain medicines that you could be on, like
Really?
taking long-term steroids. If you have COPD, asthma, and you're getting, the prednisone for a long term,
Okay.
that can cause it. Certain kidney diseases can cause it. Malabsorption can cause it. So there are several risk factors for it.
Okay, now as far as symptoms, I mean, you can't look at your bones,
Yeah.
so what are some symptoms that we should be looking
Yeah,
for?
so it's a silent disease. It's essentially diagnosed by radiological imaging, so
Okay.
essentially getting a bone density. But sometimes what happens, patients come into the ER or see their doctors for other reasons and get a chest x-ray or a CT scan, and the radiologist will comment osteopenia, osteoporosis, or they might see like vertebral fractures. So that's our clue to do more, so getting more imaging done. The other clue that the patients can have is stooped or hunched posture. So essentially your spine is no longer straight, you have like a hunched
sit up
spine.
straight.
Yep. But that essentially is a pointer that there might be some disease going on there. So those are some of the things that you should look for. Anybody 50 and older gets a fracture, needs to be evaluated for osteoporosis.
Okay, and you do that with a bone density scan?
Yes, that
Okay.
is correct,
Okay,
yeah.
wonderful. Now, as far as treatment goes, what are some things that you guys
So
do?
essentially boils down to good nutrition, eating enough protein in your diet, weight-bearing exercises, taking vitamin D and calcium. So mainly through diet, but then you can also take supplements. You have to discuss with your physician how much amount, because that supplement would matter on your background, what kind of medical history you have, other medications you have. And then there are certain medical, like medicines that we can do, like bisphosphonates, and you have to discuss with your doctor if that is the right choice for you.
Okay, and then how do we get a hold of you? Where are you at?
Yep, I'm at 4069 Lake Drive, Spectrum Health Facility, and our phone number is 267-7700.